difference between a child and an adult in regards to the spine is there are areas internal that are a little different, but overall just the bones are smaller, the joints aren't as stable. So when we look at this, in all reality, what you're looking for in a child versus an adult is the same thing. You're looking for this C-shaped spine. The child may have a little bit of a larger spine. It's difficult to get them to stand perfect, but here's what we're looking at is there's normality within both. Now, any logical person would assume that, yes, the adult has stronger muscles, stronger ligaments, a higher ability to adapt to a trauma. I mean, in all reality, adults can adapt quicker to an environmental change, especially with a trauma like an auto accident. Whereas children's spines are more flexible historically than adults, but their bodies aren't able to comprehend the change as different. And because the muscles are not as strong, and because the ligaments are less trained to support the body, these muscles and ligaments are actually more targeted for injury. And here's the thing, is that if a force hits these two people at the exact same amplitude, it's going to cause issues in each of those individuals. But because the child doesn't know how to comprehend his pain, doesn't know what pain is, doesn't know what the way of communicating a headache or stomach discomfort, the child is historically chalked up as, hey, he's not bleeding, no broken bones, your kid's perfectly fine. The adult, though, is now under chiropractic care, taking daily pain medications, and steel, which was in the frame of the car, was bent. But logic again says, no, the child wasn't injured, the adult was, but the car on both sides was caused. The whole purpose of this is that with auto accidents, children as well as adults are affected. When we look at this x-ray, this is a 7-year-old who was involved in an auto accident. Mom and dad are driving, children are on the back, both in booster seats. There was a rear impact of the vehicle about 40 miles an hour. It was strong enough to rip off the bumper, push the car up. It was still drivable, but the trauma was targeted in the back of the car, and then the force went up. So most of the injury to the vehicle was in the back of the car, and of course the kids are in the back of the seat. Now, mom did nothing at first because the kid wasn't broken. There was no bleeding, no bones that were, having issues, minor bruises. So when she brought us this child, here's the thing, he's having headaches, having sleep disturbances, not quite sure what is caused by, and her doctor on her phone, because we don't go to our doctors anymore, we just call or text them, they said, hey, don't worry, give him some medicine, you'll be just fine. When we look at this x-ray, there are a lot of things except fine. First thing is the structure of the spine. With this child, it was not in a proper position before the accident, so his body's more prone to injury. When you have the loss of the curve in this upper area, I wouldn't argue that this was caused by the accident, but the mechanical movement will be altered. Structurally, this was there before the accident ever happened. So not having your spine checked prior to an accident, it's just as crazy as not bringing your child to a dentist. It's bones versus bones. The bones right here get checked, but the bones right here don't get checked. So when we went through the motion study, we wanted to replicate how the neck went. And going forward was fine. Going backwards was a little bit different. There is actually instability in the spine that is recorded and digitally enhanced through a computer program, shows that instability right there may have been the direct cause of the actual accident. And here's the thing, is that when we look at injury, it needs to be individualized to each person. If you're involved in an accident, the worst thing you can do is ignore the symptoms and take medication. Medicine will minimize the symptom and not allow your body to adapt to its environment. The second worst thing you can do is ignore it is if you don't have any pain. Pain is a very small indicator of the trauma associated. I mean, come on. People don't show up with pain an hour before they're going to have a heart attack, even though their heart's shutting down over the past few years. The second thing is if you bring your child to a chiropractor, it's one of the best things because we focus only on the muscles, tissues, and bones of the spine. That's all we do is spine, and we all know that auto accidents affect the spine. Children respond quicker than adults do. It's easier to get them the results, and they love getting adjusted. Make sure that when you get an auto accident, you get your spine checked. Regardless of it, research anything over 10 miles an hour will cause structural injury to your spine.